Welcome to the deep dive.
Glad to be here.
Today we're tackling a stack of sources all focused on one really critical topic, stroke.
Right. We've got texts covering pretty much the whole journey, haven't we? From spotting it outside the hospital to what happens right when someone arrives, and even the very beginning of rehab.
Exactly. And our mission in this deep dive is to pull out those absolute must-knows. Things like the quick tests, those critical timelines in the hospital, and, the first steps in recovery.
So you walk away really understanding this very fast-moving medical event.
Okay, let's unpack this. Where do we start?
Well, what's really striking is how the sources stress that the first, maybe most critical step actually happens before anyone even gets near a hospital.
Ah, okay. Recognizing it out in the world.
Yes, it's all about spotting those sudden onset neurological symptoms, that sudden change.
Right, and they give us a really practical tool for that, don't they? The FAST test. It's pretty well known, but maybe unpack that for us. What are we looking for?
Yeah, FAST is it's a mnemonic, basically a memory aid. So F is for face. You ask the person to smile. Look closely. Is one side of the face drooping down?
Okay, face. Got it.
Then A is for arms.
Okay.
Ask them to raise both arms up. Does one arm kind of drift downwards or they can't lift it at all?
Arms drifting. Okay.
S is for speech. Get them to repeat a simple phrase, like the sky is blue. Is their speech slurred? Does it sound strange? Are they unable to speak?
Slurred or strange speech. Makes sense.
And then the really crucial one, T is for time. If you see any of these signs, face drooping, arm weakness, speech difficulty, it's time to call emergency services.
Yeah.
Immediately.
Don't wait.
Absolutely not. And the sources also mention checking glucose if you can, because very low blood sugar can sometimes look a lot like a stroke.
Interesting point. Okay, so that's the vital first step, outside fast and act fast. What happens the second that person hits the hospital doors? The sources talk about a clock starting, right?
Oh, absolutely. The speed here is just, incredible. For anyone coming in with a suspected stroke or even a TIA, that's a transient ischemic attack, like a mini stroke.
A warning sign.
Exactly, a serious warning sign. There's an immediate admission process. Like within the first 10 minutes, they're already doing vital signs, drawing blood, getting IV access set up, checking that glucose again, and crucially, ordering a brain scan, CT or MRI.
Yeah.
It's intense.
Wow, 10 minutes, that's a whirlwind. And I saw the ABCD score mentioned for TIA patients. What's that about?
Ah, yes, the ABCD score, or sometimes ABCD squared. It's basically a risk assessment tool used specifically after a TIA.
For predict risk.
Yeah, to gauge the risk of that person having a full stroke very soon. It helps decide how urgently they need specialist follow-up. It gives points for things like 8/60 gets a point, blood pressure high BP gets a point, clinical features like specific weakness or speech trouble, duration of the TIA symptoms, and diabetes.
So it's looking beyond just the immediate event.
Precisely. It shows how risk isn't just the symptoms you saw, but also these background health factors. It's quite insightful.
And imaging sounds absolutely critical very early on.
Yes, definitely. The sources really hammer this home. Brain imaging needs to happen fast, especially if there's any worry about bleeding in the brain.
Like if someone's on blood thinners.
Exactly. Or if their symptoms are a bit unusual, maybe their level of consciousness is down. Doctors might use something like the Glasgow Coma Scale for that, or if they have a really severe headache or signs of pressure like papilledema. Imaging clarifies things immediately, guiding treatment.
Okay, so after that initial burst of activity, assessment, maybe the ABCD score, imaging, the sources map out a really rapid sequence leading to treatment decisions.
They do. It's all about minimizing delay. Within about 25 minutes of arrival, a more detailed neurological assessment and history should be done. By 45 minutes, ideally, that CT scan is complete and actually reviewed by a doctor.
45 minutes for scan and review. Still incredibly fast.
It is. And if there's no bleeding seen on that scan, then they can start thinking about fibrinolytic therapy. That's the powerful clot-busting drug. But there's a very tight time window for that.
And if there is bleeding, or they can't get the clot buster,
Then typically aspirin is given, usually within 60 minutes, and the patient gets admitted, ideally straight to a specialized stroke unit or maybe an ICU. The speed through this whole process is just paramount because, as the sources often say, time equals brain. Lost time means lost brain function.
time equals brain. That really sticks with you. Okay, so amazing speed in those first minutes and hours. Once things stabilize a bit, the focus shifts, right, towards recovery. The sources talk about physiotherapy starting. When does that actually begin?
Yeah, this is another point about the whole continuum of care. And what might surprise you is how early rehab, specifically physio, gets started. The sources say the initial assessment should happen as soon as possible, often within 24 hours of the patient arriving at the hospital.
Within 24 hours.
Mm.
Wow, that's immediate.
It really is. It's seen as a crucial, immediate intervention, not something you wait weeks for.
So what does that very early physio even look like? Are they doing intense exercises right away?
Not necessarily intense, but focused. It's initially about preventing complications and just starting the recovery process.
Hmm.
So things like making sure the patient is positioned correctly in bed or in a chair to protect limbs and prevent pressure sores.
Right, basic but important stuff.
Very important. Also, helping patients and their families learn safe ways to handle and move, elevating limbs if they're swelling, and critically, encouraging early mobilization, getting them moving even a little as soon as it's safe.
To prevent other problems like clots.
Exactly, to help prevent things like deep vein thrombosis, those blood clots that can form in the legs when someone's immobile for too long. The goal is really to minimize bed rest and gradually, safely increase activity.
And I think you mentioned balance. That's often affected, isn't it?
Hugely affected. Impaired balance is super common after a stroke, and it leads to a real fear of falling, which can then limit activity even more. So the sources emphasize focusing on balance training early on and exercises for the trunk muscles, which are key for stability.
Even if someone can't stand yet.
Yes, even then, they might practice things like reaching for objects while sitting, activities that challenge their balance safely within their current abilities. It's all about starting where the patient is at.
Okay, so we've covered quite a bit. We've navigated that quick assessment outside the hospitals, the FAST test. We've stepped through the incredibly urgent hospital timeline, touching on things like the ABCD score for TIAs, the critical decisions around
And
imaging.
the rapid treatment pathways.
And then we touched on that crucial, really early start to physiotherapy, focusing on things like balance, mobility, just preventing those early complications.
So when you pull it all together, what does it really show us?
Well, it seems to highlight that dealing with a stroke isn't just one single moment or reaction. It's this rapid, highly coordinated, multi-stage process.
Absolutely. It demands swift, informed action right from the first sign anyone notices, through those incredibly time-sensitive hospital interventions, and then straight to the first steps of recovery. It's a whole system response.
Which does raise an interesting question, doesn't it? When you think about the sheer speed and the complexity needed from the medical side at every single stage, how does that mirror the body's own incredibly complex and, frankly, delicate systems that were affected in the first place?
That's a deep thought. How the precision of the response reflects the precision of the system it's trying to save.
Exactly. Something for you to think about as you process all this information.